Good afternoon, everybody. Happy Monday. It is October 12th. We're almost midway through October now. Just want to welcome you back to our episode of Family in Focus here on PHLV Radio. You can also be watching this live on Facebook. So it's going to be on the Facebook for PHLV Radio and also for the Asian Community Development Council, the nonpartisan nonprofit that is helping to host this radio show that we put on every week, every Monday at noon. We try to touch on different issues affecting and impacting the Asian American Pacific Islander community. And in general, especially with the topic that we're talking about today, we're going to be focusing on vaccinations with flu shots. Of course, we're now getting into flu season, so important to get your vaccination. So we want to talk with an expert on this to talk about why it's so important to get your flu shots and also some upcoming events that you can get your flu shots for absolutely free. So if you want to get more information on that, stick around for our show today, which is going to be a really informative one. We're going to talk about what ACDC is doing as well in terms of getting people enrolled in health insurance. Open enrollment is coming up soon. So we're going to talk about that as well. So first, let me get right to our first guest today. We're going to be talking with the education manager of Immunize Nevada. Her name is Brianne Van Dyne. Thank you so much for joining us today, Brianne.
Yeah, of course. Thank you for having us.
So, Brianne, tell us first a little bit more about Immunize Nevada. This coalition has been around for some time now. What are you all doing, especially right now during this time of the year?
Yeah, so Immunize Nevada is the only statewide nonprofit dedicated to immunizations. And we do this through participating and organizing various outreach, events and opportunities, through advocacy efforts and education of healthcare professionals around best practices for immunizing. Right now, we are really focused on flu prevention. So we are deep in the weeds of flu clinic planning with various partners, including ECDC.
And yes, talking about ACDC, we actually have an event we're going to tell you about coming up in a little bit where you can come drive up to get your flu shot. So a lot of people talk vaccinations, of course, the big thing right now. We're talking about COVID-19. We don't have a vaccine for that yet. That is something we're hoping to get by sometime early next year. But when it comes to the flu, we've had a vaccine for that for a long time, but still we need to talk about this every year because there's still misinformation out there. There's still people don't have enough resources. So what can you tell us about the flu shots? Obviously, this is the time to get the flu shot. So why now?
We are approaching the height of cold and flu season right now. So we're asking that everybody get their flu vaccine optimally by the end of this month. Luckily, it's never too late in the fall and winter season to get your flu vaccine. So if you don't get it by Nevada Day or October 31st, it's not too late. We still recommend doing that. And just a few reasons why it's so important. We've all heard of the twindemic, so the convergence of COVID-19 with the flu season. Why we need to protect ourselves from the flu is multifold. So we first have to be mindful of not overburdening our healthcare systems. If we can avoid unnecessary trips to the doctors and the hospitals locally and statewide, due to the flu, we would want to do that. Also, by getting your flu vaccine, you're protecting individuals who cannot get vaccinated against the flu. So that includes those younger than 6 months of age or those with certain contraindications that would prevent them from getting the flu vaccine, such as cancer patients. And then also, if you happen to get the flu, but you've received your flu vaccine, because you got a strain of the flu that wasn't maybe in this season's shot, then your likelihood and the duration or likelihood of hospitalization goes way down, and the duration of your illness from flu is exponentially decreased as well. So all important reasons to get your flu vaccine right now.
Yeah, and the Asian Community Development Council has really worked hard to get the word out and get people vaccinated. I actually got my flu shot last week, and I think we have some pictures from that event where ACDC hosted at their headquarters at Shanghai Plaza in Chinatown here in Las Vegas. And this is in partnership with Roseman University College of Pharmacy, where the public gets to come in and get their flu shot. So right now, and as you mentioned, COVID-19, some people might still, should I get the flu vaccine? Will it affect if I'm going to get sick, or am I protected from COVID-19? What's some of the misinformation out there that you want to address, especially when it comes to getting your flu shot now?
So I think one of the biggest pieces of misinformation is that getting your flu vaccine makes you more susceptible to getting other viruses or weakens your immune system somehow. And there's just not strong evidence to support that. Again, there's so many more reasons to get vaccinated, especially to protect against flu, than to not. Again, I think that it's important to note that the flu vaccine is tested for safety and effectiveness in the same way that the other vaccines that are on the recommended schedule are. There's 4 different safety mechanisms for tracking the safety and effectiveness of the flu vaccine and all the other vaccines that are on the market right now. So far more reasons to get it than not, especially we would hate to be infected with both flu and COVID at the same time. I couldn't think of anything more miserable.
Yeah. And I'm seeing signs everywhere for people to get flu shots. I know in past years, there've been some shortages. Are there enough flu shots to go around, especially here in Nevada right now?
There are. So flu vaccine season is in full swing. Luckily, there's various opportunities and locations for getting your flu vaccine, including your private provider. We're really lucky in Nevada that pharmacists have a really broad vaccinating authority. So they stock both pediatric and adult flu vaccine, as well as that high dose vaccine that's recommended for seniors age 65 and up. We are hearing a little bit of news that the high dose vaccine for seniors is in high demand. So we encourage you not to get discouraged if you happen to go to a location in which they're out of that high dose flu vaccine. You can always call Immunize Nevada, and we're happy to point you towards a clinic location where you can access that as well. But we're seeing really promising numbers so far as the vaccination coverage levels this season in comparison to seasons past. So we're hoping that that's a trend that will continue.
Yeah, we're going to put a link to your site on this Facebook comment as well. And if you're watching us on Facebook right now, feel free to drop in your comments or any questions or anything that you may have. If anyone from ACDC or from Immunize Nevada can answer, we'll try to get that information to you and maybe get Brianne to answer some of the questions here live on Facebook as well. And Brianne, I'm actually going to give you a little break. I'm going to bring in our other guests coming in today to talk with us. Her name is Yim Nguyen, and she's one of the healthcare navigators at the Asian Community Development Council. And Yim, you've been working with ACDC for a while, especially in terms of healthcare. Talk a little bit about your experience. I know you saw that we had a health flu clinic that just happened, but you work day in and day out just talking to people to get them insured and stay healthy year round. And this is especially important because, Yim, talk to us about the open enrollment that's coming up in less than a month now.
Okay, this year I have a good experience about a flu clinic because last year I usually take a flu shot every year, but not last year because I think I'm so healthy, my family is so healthy, I don't need it. But I so scared all flu season, and in this year my daughter is so scared, and she asked me go to take a flu shot 1 month ago.
I think you brought up a good point because a lot of people right now, I think, are probably more concerned because of COVID-19. Yes. They're taking care of your health. So you went and got your flu shot this year. So how are you feeling? Everything's still good? You and your family all got your flu shots?
Yes, all my family is got the flu shot, and I have to call my my relative, my sister, my whole family have to get the flu shots as soon as possible because it's very important for this year.
Yeah, I think it's so important, especially get it now and get it early. Yeah. And so talk to me a little bit about the work you do at ACDC, especially when it comes to open enrollment. You're getting a lot of questions on that right now.
Yes. It will coming in November 1st. And this year we have the longer periods because we will stay from November 1st up to January 15th, 1 month extra. Like the other year just finished as December 15th, but this year will come with January 15th. It's so good for everybody to get health insurance. And I hope that more people, yes.
So what do you offer in terms of open enrollment? If people have never gone through this process before, what can they get? I mean, are they getting a look at different kind of health insurance plans that are available, especially those under affordable care?
Yeah. It's easier for everybody to contact with us to make an appointment, and we will help them to get health insurance. And all of our service is for free and easy for our client to get health insurance with us. They don't have to come to our office. We can do Zoom meeting, and we can enroll for client by Zoom meeting.
And that's what's important. I know we have a headquarter at Shanghai Plaza, but a lot of the meetings are by appointments only, and you can do Zoom meeting as well. I
Yes,
know people
yes.
are asking about health, but also I think another great program that ACDC is doing, we want to talk about, and maybe you can share a little bit about the direct cash assistance, because people can actually get money, just direct cash, with the help of ACDC right now.
Yes, it's just useful for everybody because on a lot of people lost the job during COVID-19. A lot of people have affected by COVID-19, but not all of them get the unemployment benefit, right? They didn't get Medicaid. They didn't get any support from government, from federal, and direct cash assistance will give them a chance to get more benefit, and they support not too much because just $300 per person, so not too much, but it helped.
Yeah, a lot of help that your
Yeah.
team is putting out there, along with giving people in language help as well. I know you speak Vietnamese. Do you want to share some of maybe talk a little bit about open enrollment and also the direct cash assistance to our Vietnamese viewers out there right now?
Yes, chào mọi người. Hiện nay chương trình Direct Cash Assistance của ACDC vẫn tiếp tục, và mọi người nếu mà bị mất việc và không có cái không nhận được bất cứ cái benefit nào từ federal thì có thể liên lạc ACDC để tham gia vào chương trình Direct Cash Assistance với $300. Ngoài ra thì mình sắp có cái Open Enrollment vào ngày 1 tháng 11 và rất mong mọi người có thể contact với ACDC để được giúp đỡ để có cái bảo hiểm trong năm sau. Xin cảm ơn. Yes.
Yeah, and we want to invite people, Yim, to our next event. So we have some of the events coming up, new distributions, and also drive up clinic that I'm going to be talking to Brianna about.
Yes, yeah. We will have the drive up clinic, flu clinic with Immunize Nevada on October 25th. And close by we have a meal distribution too, and hope that everybody can come with ACDC to get the flu shot and everything for free. You don't need to show your insurance. It's very important because right now a lot of people have not insurance, and you should not care about that.
Yeah, well, thank you so much, Yim, for hopping on and sharing some information with us. And Yim was just talking there about people who are uninsured and or maybe underinsured. And I want to bring Brianne back in. She's the education manager with Immunize Nevada, because there may be people out there right now, Brianne, who said, hey, I don't have health insurance. I haven't had time to sign up yet. I don't have the funds. Can I still get a flu shot free of charge? And you said you have some information that you can share with them.
Yeah, absolutely. So in addition to the link that we provided, just immunizenevada.org/calendar, that has our community clinics for getting your flu vaccine listed, both ones that we co-host and those who our partners host separate from Immunize Nevada. But many of those clinics in the community do cater to uninsured and underinsured individuals. Each clinic is a little different just based on who is running it. So we encourage you to visit that calendar and click on the details to learn a little bit more. But also a great location or opportunity for those who are uninsured or underinsured, meaning that their insurance doesn't cover vaccines, would be to visit Southern Nevada Health District down in Las Vegas. They provide vaccines at low or no cost to those who cannot afford it, either through the Vaccines for Children program, which is a federal program that provides those vaccines, or 317 adult vaccines. We would encourage that if that's something that concerns you, that you go ahead and call any one of the Southern Nevada Health District locations, and they can connect you with a clinic that has that 317 adult vaccine in stock, or all of their clinics stock vaccines for children as well.
Yeah, and we're just getting some questions just about, maybe the ins and outs of getting a flu shot. Like Yim, she hadn't gotten it for a while, and then now she's getting it for the first time. Anything people should expect? I know when I got mine last week, I forgot how sore your arm can get after getting a vaccination. So talk to me about the side effects, and people can, people can actually get a little bit sick maybe right after, but also the fact that it takes a few weeks for vaccinations to actually kicked in, right? So talk to us about all the in and outs and what people need to know before they even go and get their flu shot.
Sure. So luckily, if you've never received a flu vaccine before, if this is your first time, there's nothing you need to do to prepare. But some of the things to expect is that the most common side effect is going to be soreness at the injection site. So what you can do to alleviate that is get it in your non-dominant arms, whatever arm that you don't typically use as often. For me, that would be my left arm because I right with my right. And then also, there is a chance of a robust immune response immediately following getting your flu vaccine. So you might feel a little under the weather for a day or so. That's actually a good sign. It means that your immune system is doing what it's supposed to be doing and developing those antibodies to help protect you from those strains of the flu in the future. So again, if you do experience any of those symptoms, just at the direction of your physician, of course, you can use some over-the-counter pain medication, ibuprofen or Tylenol, those kinds of meds, or icing directly where the flu shot was made may help to reduce that swelling and inflammation that comes from immediately following the shot.
Yeah. And, when it comes to protecting you against the flu, that's why we want you to get as early as possible, because it takes a little bit of a time for the vaccination to kick in.
It does. So that's a great point to make. So it's going to take at least 2 weeks for your body to develop the antibodies that it needs to ward off the infection from the strains of the influenza virus that were contained in that vaccine. So you want to make sure, especially if you now in the age of social distancing, we would hope that there's not a lot of folks getting together, but in advance of any sort of gathering or any of that, it's especially important to get your flu vaccine at least 2 weeks in advance so that it offers that protection from those strains of the virus.
And I think it's worth noting, we've been talking about COVID-19, that has kind of taken over the conversation of how contagious that is. And the flu is also contagious, right? And that's why it's so important to get vaccinated.
Yes, absolutely. So it is transmitted in much the same way. So respiratory droplets. So that's why the flu vaccine is such a great tool in your kind of pandemic toolkit, so far as pairing with social distancing and mask wearing and increased hand washing. Your flu vaccine just provides that one additional layer of protection from contracting the flu virus this season.
And Brianne, we just got a question in from Facebook. Let me read it to you. So someone's asking, are there flu vaccine information materials available in language other than English? Do you offer that help with Immunize Nevada?
We do. So primarily our materials for Nevada specific materials are translated into Spanish only in addition to English, but we're happy to connect anyone with resources with additional languages from some of our other national federal partners who offer more information about the flu vaccine. So absolutely, you can email if you have any questions directly to our info@immunizenevada.org email address, and we will be sure to source those materials for you. If they're not ours, we'll make sure to find a national entity that does have them.
Yeah, and I think that's why it's so great that Immunize Nevada partner with groups like ACDC, which is really kind of, that's what they're known to do. It's provide in-language assistance. I know at the flu clinic at the ACDC that I went to this past week, they actually printed out instructions on what to do after your flu shot in many different languages. So I think that really helps a lot of people in the community, especially to get information, whether, for kids or for older people who may not be able to get that information as readily available. Anything else, Brianne, that I have not touched on, and I want you to kind of get the word out there, just especially just how urgent it is to get out there, especially when there are enough vaccinations out there for the flu right now.
Absolutely. So I think the point that we really want to hammer home is that there are numerous safe opportunities for you to get your flu vaccine this season. We know that some folks have been nervous, understandably, about going to certain medical facilities or pharmacies and the like to get any sort of service, vaccines included. So we just want to ensure you that our partners and ourselves as an organization are taking every precaution to keep folks safe at our community clinics. We're encouraging social distancing. When available, we're scheduling appointments in advance so that we can get as much of that paperwork done on the front end and not having that face-to-face contact when unnecessary. There's lots of sanitizing and mask wearing. So in addition to our community clinics, we know that our partners and your healthcare providers are taking all of these same precautions to keep you safe. So I think it's important to note that, it's worth venturing out, getting a flu vaccine. We actually have some drive-through opportunities that are coming up as well. So you don't even have to get out of your car. So if that's something that worries you, especially for senior populations, that might be a good option for folks as well. So again, if you go to immunizenevada.org/calendars to look at those community clinic opportunities and just peruse our website in general, we have lots of resources on there, lots of information related to the flu vaccine and all vaccines across the lifespan.
Yeah, no, that's great. And we have a question. Someone is asking about the myths of flu vaccine. And I think you talked a little bit about that, where people can get the flu, of getting a flu vaccine, but you can't, you don't get, you can feel a little bit under the weather, but you can't get the flu from the flu vaccine, right?
Yes. So that's a really important misconception to note. The flu vaccine can literally not give you the flu. It's not possible. It's made with a dead or weakened version or a part of the virus that prevents it from manifesting as the normal virus would in your system. It's really just, again, inducing that immune response to keep you safe from those strains in the future. A lot of the times, kind of like we talked about earlier, with that feeling kind of under the weather immediately following the flu vaccine, folks are quick to write off the flu vaccine as the cause of that. Whereas, it's very possible that you were exposed to the virus a few days in advance of getting your flu vaccine. And again, the flu vaccine for each season changes based on the most prevalent strains in the Southern Hemisphere. So we were, the vaccine developers were looking at the Southern Hemisphere, like Australia and countries like that, to determine what were the most common circulating strains in those areas to help develop our vaccine. Sometimes that's a really great match for what we see here locally, and other times it's not. But it's really, really important to get some protection is better than none. And again, those who receive their flu vaccine and still end up getting a strain that's not included in the vaccine historically have seen far less rates of hospitalization and severe illness associated with flu. So still all great reasons to get your flu vaccine this season and all the seasons following.
Awesome. So great advice today from Brianne Van Dyne. She's with Immunize Nevada, education manager there. And Immunize Nevada, along with Roseman University College of Nursing, will be helping ACDC put on this drive-by flu clinic. I mean, how convenient is that? You don't even need to get out of your car and you can get your shot. So that's happening coming up on October 25th. And that's going to be a meal distribution that's happening at Chinatown Plaza. That's coming up. So look on our Facebook page that you're watching us right now at ACDC. And we're going to have more information on that. We also have immunodistribution coming up on the 18th. So if you want help in that sense, get more information there. And coming up next week on Family in Focus, we're going to talk about open enrollment. I know Yim Nguyen with ACDC gave us a preview. We're going to talk more about that coming up next week. So if you do need health insurance, need more information, you can actually find more information now. You can help look through ACDC to help sign up as well. But for today, I think we're running out of time. But thank you so much for everybody for tuning in, asking great questions, and joining in the conversation. Thank you so much to Brianne with Immunize Nevada. Thank you to Yim Nguyen for all her hard work at the ACDC and for being our special guest on the show today. And we hope to see you next Monday. Thank you so much for joining us here on Education Livestream.